Hi, my name is Carl Pearson, and this is one on a single-payer system, which I believe is important for you to see and learn about some facts that aren't really known to everyone. Politicians don't have enough time in debates or in interviews to explain all of the costs that exist in absence of a single-payer system, and one that provides free medical care for all. In this video, I'm going to outline the most significant costs as I see them. And I'm highly prejudiced, I want to admit, and strongly believe the nation needs a single-payer system for all. I will explain why along the way. I'm 83 years old, a high school dropout. I received my degree, a BA magna cum laude in political science, and I'm a graduate of Harvard Law School. I'm also a consumer. At 83, I'm a recipient of Medicare. So I'm highly vulnerable to COVID-19 and could never have afforded the medical services I have received during the past year. To put it another way, I'm probably alive today because very low-cost health care services were available to me through Medicare. So being a small business person and a practicing attorney with a very small law firm does not leave enough income to pay medical expenses of $100,000, $200,000, or $300,000, and those expenses have to be doubled to take our nation's tax structure into account. In other words, I would have to pay a tax of $100,000 on $200,000 of supposed income to arrive at the $100,000 to pay for health care. Or I would have to pay $300,000 if the bill were $300,000. So I'd have to earn $600,000 in order to pay a tax of $300,000 in order to pay the other half to the medical provider in absence of Medicare. So it's just hopeless for people like me and you, unless you have a single-payer system. I saw the bills, and I'm forever grateful that I have Medicare coverage, because without this coverage I probably would not have survived. And this is months before the existence of COVID-19 in China became known to us. In other words, many months before COVID-19 was even on the horizon, all of this was happening to me. So number one, first of all, a single-payer system is not communist or socialist. The providers would be doctors, nurses, physician assistants, hospitals, professional firms, and others not employed or owned by the federal, state, or local government. On the other hand, public schools, veterans' hospitals, and the nation's highways, I suppose, you could call socialist, but not the single-payer system advocated for the U.S. So please don't allow rhetoric to cloud your thinking about a single-payer healthcare system. Two, 25 million individuals are being threatened with the loss of their Obamacare and Medicaid coverage. 18 Republican states are in the U.S. Supreme Court advocating that Obamacare and Medicaid be declared unconstitutional. The Trump administration has filed documents in support of declaring the law unconstitutional and has no plans for any replacement program. To avoid losing votes from individuals who just lost medical coverage, and especially during the pandemic, the Trump administration has asked the U.S. Supreme Court to defer its ruling until after the November 2020 elections, which the justices are apparently willing to do. It should also be noted that a Democratic win in November 2020 would not end the lawsuit by the 18 Republican states, wouldn't change the control of the Supreme Court, so that there is a real threat if either Trump wins or the Senate remains under control of the Republicans. In other words, preservation of Obamacare and Medicaid for 25 million individuals may depend on the Democrats winning both the Senate and the presidency. 3. The pandemic underscores the necessity of having a single-payer system to eliminate the main reason why uninsured persons with coronavirus symptoms or other medical reasons are reluctant to go for testing or treatment, because they can't afford to pay for the services, even if a test might cost as little as $20 or $30. That money many need for food. And another reason is that many individuals needing testing or other emergency medical services believe they have a greater need to retain their job, that is, when they still had a job, or are afraid of being arrested on an outstanding criminal warrant or for deportation. These issues prevent healthcare specialists from finding out who is a carrier and enables more persons to contract the virus as a result. 4. The failure of coronavirus carriers to go for testing infects many others with virus-causing deaths. Loss of the income provider to the survivors, costs to try to find the newly infected individuals, a higher cost to try to bend the curve, higher welfare and social costs, increased criminal conduct, additional economic depression for persons already at the bottom, loss of federal, state, and local tax revenues, firing of federal, local, and state employees as a result, and consequent loss of their benefits, use of more PPE, depriving PPE from some essential persons, and a lot more which I haven't really bothered to put down. Now that I'm on the COVID-19 topic, I want to give you some needed hope. I think it's necessary at this point. Up to April 2020, I had never heard of Draco. That's D-R-A-C-O. This month, when speaking to a highly knowledgeable person about vaccine development, I was alerted to the possibility that Draco could be a cure as distinguished from a vaccine, and that Draco development seems to have been suppressed starting in 2011 or earlier. I decided to look into these possibilities. Here's what I did. On May 14th, for a 2-hour period, I took 2 pages of Google and Reddit research results and put them in chronological order, prepared a video text, and made a YouTube video, number 28, 27, reporting on this chronological history to let you and me understand what has happened to Draco. And on May 18th, I spent a few hours getting the text of my video to elected politicians and the news media, including the political shows, hoping that Draco will receive funding and that Draco will be proven to be a cure for COVID-19. This is more apt to occur than the availability of a vaccine by the end of 2020. So that's the end of what I think is somewhat hopeful, the fact that we've overlooked a potential cure. Dramatically and without understanding, we've overlooked it. Anyway, here's number 5. The main objection to having a single-payer system has been that the major corporations and unions are providing employee health care coverage, often providing greater benefits than Medicare, so that the employees and union members are content with their superior coverage and don't want to be pulled down by a single-payer system that would end their superior coverage. This argument was being made, of course, prior to the coronavirus. Now, 40 million unionized and non-union employees have been terminated, together with their medical coverage. And at 3.5 persons per family, there are now approximately an additional 120 million individuals who have just lost their medical coverage, most of them broke, and many of them threatened with loss of their homes and too many waiting in bread lines for food handouts. Ask them now how they like their employer and union-based health care coverage. 6. The nation needs free health care for all to substantially reduce the infections and deaths from the coronavirus and to bring the pandemic under control as soon as possible. 7. The cost of medicines is beyond the ability of many people to pay because of patent protection, the ability of big pharma to sell prescription medicines at very high prices in the U.S. and at much lower prices abroad, and the U.S. law prohibiting the purchase and importation of these lower cost medicines at the substantially lower prices. 8. The cost of not providing free medical care for all is going to be a depression far worse than the Great Depression. More deaths than you can imagine, and I'm talking about millions in the U.S., a much greater concentration of the economy as the small businesses and middle class get wiped out, the rich buying up your mortgaged and rented assets for pennies on the dollar, and the loss of our democracy as an experiment that failed. 9. You had better be in continued good health because you'll have no money to pay for health care, assuming that it is even available when the demand far exceeds the supply, which means that the rich get cured and you do not, and that's probably the reason why we don't have the legislation that we need. The ones who could do the legislation are in a much better position to weather the storm and believe that they actually will be better off if the rest of us don't have to be dragged along. 10. Medicare is not a single-payer health care system because it applies only to older persons, and it is replete with co-pays, minimums, and supplemental coverage, all of which has cost me several $1,000s per year, which I can afford. But I spend about 100 hours per year of my time in doing what is required under Medicare, such as reading and paying medical co-pay bills, usually requiring me to write a check for about $8 or so, and then following up with that check and inputting it and accounting for it, opening and reading email and mail that tells me how much I should have paid each quarter under Medicare, pouring through advertisements and making calculations of the cost of medicine for the next year to determine the best supplemental coverage, if any at all, for me, reading about healthcare options, making a list of each notice, bill, and payment, ordering and paying for medicines. Yes, I think that 100 hours per year or 2 hours per week is just about right. 11. I'm an attorney and I make a living by selling my legal time for $450 an hour. The 100 hours of time I put in each year cost me $45,000 in lost billing and costs the governments about $20,000 in taxes. You have the same problem. There's an externalization of costs here, that all the time that you have to put in has to be added. The things that you might otherwise have been able to do have to be added back as a cost of a system that honestly sucks. 12. The present system imposes too many costs on small business persons such as myself, and too many risks upon employees of big business and union members, as well as upon people with no money, and the obvious solution is a free single-payer system. In closing, I want to add that the present U.S. system costs twice as much as the single-payer systems of other major countries, and in the U.S., health care coverage is probably only available to 40% of the population, and I'm guessing at that pre-virus percentage. This means that we are paying 5 times as much as other countries for the health care services actually provided. I arrive at the figure 5 by taking 2 for the twice the cost element and 2.5 for the 40%. That is 2 0.5 times 100 is 40%, that are covered by insurance, which is increasing daily with more terminations of employment, so I have rounded the number up to 5. Healthcare is a necessity comparable to food and water, especially in a depression. We need to eliminate all the paper shuffling and recognize that it is far less costly to the nation to have a free single-payer system for all than to have the present for-profit system and its administrative obstacles prevent the population from exercising their right to have health care. I hope this analysis gets you to think more favorably about a free single-payer health care system for all without having to prove more than you're showing up alive at the provider's place of business. Well, I've said what I plan to say, and I'll say so long until my next video.